Good morning and welcome to Viewpoint, your program of personalities, politicians, and perspectives. And we'll start right out this morning with another great perspective, as we've been doing for the past 2 or 3 weeks, 4 weeks now, I think. We have been bringing the program up right to date with a friend who's walking from Chicago to Los Angeles on old Route 66. Our good friend Rasheed Hooda. And where are you today? Good morning, Rasheed, and where are you today, sir?
Well, I'm not on Route 66 today.
Oh,
I am actually in Houston, Texas this morning. I took a week off to celebrate a religious holiday, which was Monday, and spend some time with family. And I will be back in Joplin where I left off on Sunday. I'll be leaving Houston Saturday via Greyhound and be there Sunday morning and continue on from there.
Now,
so that's where I am.
You made arrangements then for somebody to store your what I call your perambulator and take care of your worldly goods, and then you'll be go back to Joplin. Is that where you will be, sir?
That's correct. That's correct.
And
I was introduced to this gentleman by somebody who saw me in a park, and we talked, and it's just amazing the way the connection had been happening.
We have with us this morning, Mr. Hooda, we have my good friend and personal doctor, Dr. John Wahab, and he's appearing here as a guest on Viewpoint, talking about medical care here in Lincoln, Illinois. Dr. Wahab, if you'd like to put those headphones on, sir, I'd introduce you to Rasheed Hooda. And Mr. Hooda, would you please tell Dr. Wahab your birth? Let's see, you were born in India or Pakistan.
I was born in India, but I grew up in Pakistan.
Dr. Wahab, your family heritage is what part of that country over there, that world?
Yes, we're originally from Pakistan.
Pakistan. Have you had anything that hits you as an unusual way here in the last couple of days here on your before you decided to run to Houston for a little while?
Well, it is interesting that your good doctor is from Pakistan, because the gentleman who's holding on to my belongings while I go visit my family is a doctor from Pakistan also. And the way it happened was I was in Avila, Missouri, and when I arrived there, I was at the city park. Now, Avila has a total population of 125 people, and they have a little park in the middle of town, and I was deciding on spending the night there, but I didn't know if it was legal or safe or whatnot, and a gentleman came up and started talking to me, and then they invited me to dinner, and it turned out that his brother, who's also a member of the city board in Avila, happens to be a handyman who has a contract with a doctor in Joplin who was from Pakistan. And when he learned that I was from Pakistan also, he made a phone call to this doctor and connected two of us, and we talked. And so when I got to Joplin, I had the honor of meeting the good doctor, and he invited me into his home, and he's holding on to my belongings. Took me to Greyhound Station, and that's how I got to Houston. And when I get back, he's going to give me a ride back to his home so I can pick up my belongings and start moving again.
And be like Johnny Cash on the road again.
Yep.
Now, how's the footwear holding out? Your footwear? How many weeks can you get out of a pair of shoes going on a road like that?
Well, I bought these ones that I have on. I bought 2 weeks into my journey because the old ones weren't doing the job, and I was getting blisters, and so there was a change of footwear, and these I have worn for 5 weeks, and they are beginning to lose some of the soles. So I'm going to have to get another pair and use these as a backup in case if I need it. So I would say if I have two pairs and I rotate them, they may last longer. But 5 to 6 weeks is all I'm looking at. I may be able to stretch it to 7 or 8, but I don't know yet.
Tell me how the groceries holding up. Do you stop during the course of the day for lunch or anything like that, or you just grab a snack bar and keep on running?
Well, usually I have, by the time lunchtime comes, I am, in most cases, done with my walking. If I manage to start early, right after breakfast, because I walk around 5 to 6 hours effectively every day, which gives me about 12 to 15 miles, which is what my goal is. Mm-hmm. So if I start around 8 o'clock, by 2 o'clock, I'm done walking. So at that time, I can rest and grab something to eat if I feel like it. If I haven't had, some days it takes longer because the trip may be longer, or it may be an exceptionally hot day, and I may stop more often. But yeah, usually I grab something to eat, so I have some protein in the morning. And then I would have my nuts and dates and figs and all that good stuff.
Well, Rasheed, we're glad to have you report in this morning, and you'll be back on the road very shortly. You're currently in Houston, took a little sabbatical here. Your national holiday was what, sir?
It was called Eid al-Adha, which is the celebration of Abraham's great sacrifice to God, his only son.
All right, sir. Well, we'll catch you. We have a very important guest this morning. We're going to have to discuss some real serious matters here for Logan County, medically speaking. So we'll thank you very much, and we'll get back to you. In the meantime, I'll be touching base with you every day, and we'll talk to you next Wednesday morning.
All right, sir. Thank you so much.
Yeah, bye-bye.
I appreciate it.
All right. Thank you very much, folks, for your patience here. As you know, we've been trying to do this each Wednesday, but we have a very special guest this morning. Dr. We always start with a couple of kudos or two, and Judith Kay has one that she wants to make, so we're going to defer to her right now. Go right ahead, Mrs. Busby.
Well, we had at First Presbyterian Church, we had a block party last Saturday night. It was very well attended, and some of the attendees were, thank you, Bill. Gee, you're nice.
That's what my mother said.
Some of the attendees were the Lincoln Fire Department and the city police with their respective fire truck and squad cars. And I dare say those first responders are first rate. They were very nice. They mingled with the kids. The kids were excited about seeing a fire truck, about seeing a squad car. So hats off to Lincoln's finest.
Well, thank you very much, and they deserve that. We had some of the finest musicians in the entire state last Sunday at the First Christian Church in their Harvest of Talents presentation. My goodness gracious, I thought I was in the Mormon Tabernacle Choir.
Really?
They were just magnificent. So kudos to all of those who stepped in and helped out on that. You had a little kudo you wanted to make an appreciation for the tickets you got to go see Sully.
Oh gosh, yes. Don't miss it. Sully, downtown, beautiful downtown Lincoln. And it's, of course, I don't know how much poetic license they took. I have no idea. But, man, I'll tell you, Clint Eastwood did a yeoman's job on that movie. It was absolutely spellbinding. I've never seen anything so compelling. And
you didn't say that about my home movies I showed you.
Well, I was thinking it, though. Maybe. Or not.
All right, let's get out of serious business here, because Dr. Wahab is giving of his time.
Yes.
And so we appreciate that very much. So go right ahead, please, Judith Kay.
Yes, thank you for being with us. And you have pretty exciting news for us here in Lincoln, Logan County. Memorial Physician Services of Lincoln is bringing to us, right here in River City, a walk-in clinic. And thanks to the beauty of technology, we have a breakdown here that my friend Willie Bill gets about walk-in clinics clinics as opposed to the next step up, which would be called the urgent care. And this is a walk-in clinic. So we'll ask Dr. Wahab if he'll explain what all that entails, when it's beginning, and the physicians who are going to be, and physicians' assistants who are going to be involved in that. Thank you so much for coming out this morning. We appreciate it.
Thank you for having me this morning. So, yes, it's exciting news. For the longest time, we've been hearing from patients as providers that the most common complaint that they have is that access to health care. Of course, we'll still have the traditional scheduling visits for checkups and whatnot, but what we've done now is open a clinic for a walk-in clinic, and this is for acute illnesses and fevers and minor cuts and burns, sore throat, that type of thing.
Yeah. Many things. People go to the emergency room or emergency department for things where they don't have an appointment. Some things happen, bad things happen with kids, especially in the middle of the night. I don't know who made that rule, but it does seem to be the case. Yeah. And so this is really an answer for the people around here, and much less expensive than that level of care.
Yes, actually, for most people, the copay is going to be the same as an office visit rather than an emergency room visit. And this is the third day that we've started this, and so far it's off to a good start. We've had good feedback from patients.
Doctor, may I inquire, if somebody is, for instance, regular patients, they'll ask for Dr. Wahab or Dr. Bevan or whoever. If you walk in on the walk-in clinic and take a number, and am I correct in this? The first available physician will see them. How does that work, sir?
Different days are going to be staffed by different providers, and most of the clinics will be staffed by a nurse practitioner. Of course, the physicians are in the facility, and if there's an issue, they're available. But nurse practitioners will see the patient. Now, if a nurse practitioner is on vacation, then the provider will take care of the nurse practitioner's clinic. But this is primarily provided by the nurse practitioners.
Now, when you go to the Memorial Physician Services to take advantage of the walk-in clinic, where do you go to check in?
The same as you check in for a regular appointment. There'll be a number that you take, and the number will be called in order, and it's going to be triaged by the nursing staff. So
they won't have a special area then? It'll just be, for instance, if you were the doctor on call today, and they came to the walk-in clinic, then when their turn came up, they just go to your office space? Is that right?
Yes, just like a regular appointment. Yes.
Okay, yeah. And they can't say that, well, they'll wait for Dr. Wahab rather than see a physician's assistant, which is really going to serve you plenty well.
Right. And they're actually not physician's assistants, they're nurse practitioners.
Nurse practitioners,
a lot more training.
That's almost a doctor.
Yes.
Yeah.
That's the next step down, isn't it? Yes. Yeah. The average walk-in will experience no more wait time than an average patient, which, by the way, over our physicians' memorial services is very short. Times thank goodness I go a few times. I like doctor very much, but I don't want to see him professionally. But so wait times are very good over there.
Well, so far, of course, it's only the third day that we're going to be doing this. So far, the wait times have been averaging around 15 minutes. Which is not very long, and I think the first day they saw 30 patients, so I think that's pretty good. And the key is that these are acute visits for acute illnesses, not for chronic problems, which you should schedule with your regular doctor.
You don't come to the walk-in clinic if you think you're having a heart attack.
No.
So if you've burned your finger and come there, whether you wait 3 minutes or 10 minutes, the world will not end. Right?
That's right.
Okay.
Mrs. Busby has a way of boiling things down and distills them right down to the nth degree.
Right.
Doctor, this is the third day?
It's just started this week.
I'm sorry?
It just started this week.
You just started on it. And the, actually, you're on your third day right now then. That's a Monday, Tuesday, Wednesday. That's third day. Want to make sure.
In anybody's book.
Yeah, but seriously, have you had any feedback so far from the way this is?
So far, everything positive. Yes, from what I've been hearing from the staff.
What was the genesis of this idea, Dr. Wahab?
Patient complaints about access, and
really,
yes, for these type of illnesses that happen at really the spur of the moment. I mean, somebody has an injury or a cut or a fall and injures a wrist or an elbow and needs to be seen. It was difficult under the previous scheduling to get patients in, and we often had them go to the emergency room, which of course is a lot more expensive. But with this model, we can have these patients come in right away and be seen within a few minutes, and much less expensive than going to the emergency room.
I don't know how Memorial Health System works, of course, but do they poll you doctors and see if this is going to be a burden to you, or is it like government? Do they say, and this is what we're going to do, and this is how you fit in?
Well, we're not government employees yet, but...
God forbid.
We're going to see what happens after the election.
God forbid.
But no, this is something that we have been talking about for a better part of half a year. It's not something that we just jumped into. It was something that's been very well organized for some time, and other clinics in the area have been doing this for quite some time. Clinics in Springfield have been doing it very successfully.
And Sherman, I think, has.
Yes. So the main problem was getting the staffing and organizing it, and that took some time to do. So.
You know, let's discuss how the hours are going to work for you. You're 8 to 7 Monday through Thursday. That would be, of course, a.m. to p.m., 8 a.m. to 7 p.m., not vice versa. And just to be exact, I'm trying to nail it down here. Okay? Just hang with me, Bill. I'm getting to my point. Okay, and then Fridays are 8:30 to 11:30. Oh, that's Saturdays.
That's Saturdays.
8 to 4:30 on Fridays. Okay. Now, if it happens on Tuesday and it's after hours, you'd still have to go to the ER if you had a need, right?
Well, the answering service is available 24 hours, so you can still talk to a nurse practitioner and get some direction as to what to do. So if something happens after hours, you can either go to the emergency room or call the number at the office, and they will direct to the answering service. And if it's felt that a physician needs to be paged, that can be done. But there will not be actually somebody at the clinic after 7 p.m. to see patients.
And you would certainly encourage people to take advantage of this answering service capability. I remember one time my dad was in the basement using a blowtorch, and he blowtorched his hand, and he ran upstairs and smeared butter all over it. Okay? But my mother knew. She was very smart. She knew that was the wrong thing to do, so she scrubbed his hand. So by the time they saw anybody professional, they'd pretty well ruined him between the two of them. And if you call this number,
but you
they'd
had
say...
to appreciate that.
Well, at least they didn't put duct tape on it. That's what I don't like.
Right. Yeah, well, that and WD-40, boy, you can't live without them. Well, so anyway, they would have told him, don't put the butter on it, and they would have told her, for Pete's sake, don't scrub it. Right?
That's right.
So your best bet is to call first, right? Just like the utility company, right?
That's right.
There you go. I'll give you a turn, Bill.
Dr. Wahab, it's safe to say, or am I correct in saying it's safe to say that the average, most of the patients would not require going to the laboratory, or perhaps x-rays. Would that be a reasonable assumption? People walk in and
People that walk in? Well,
average.
we will have X-ray and lab until 5 p.m. Every day. So if that is needed, it can be done.
It can be done.
But if somebody is needing medicine refills and routine labs done, then it's probably better to schedule an appointment with your provider rather than go into the walk-in clinic, because that's not what it's really set up for. It's set up for acute visits, for things that came up at the spur of the moment that need to be seen.
Family Medical Center has I'm back.
You're living in the past.
Old password. You have a lot of physician's assistants. I don't mean nurse practitioners.
Yes.
Nurse practitioners. Yes. I want to make that very clear.
Yes.
You have there's quite a few of those on staff.
Yes.
6.
We are going to have 5 now. One of our nurse practitioners is leaving to go to another clinic that is opening up in Hy-Vee in Springfield. So she's going to staff that. So
in the Hy-Vee store?
In the Hy-Vee store.
Oh,
yes.
upon my word.
There will be a clinic opening up there. I don't know the exact date, but it's going to be soon. Yes.
Have you, has anything in the first couple of days, anything come up that was not foreseen?
So far, everything's gone very smoothly.
Real smooth.
Yes.
The hours again, and it's important for our public to know that this is a real service to the public. And the hours again are 8 a.m. to 4:30 on Friday, and 8:30 to 11:30 on Saturday. Let me see here.
Monday through Thursday.
Monday through Thursday, 8 a.m. to 7. As you just went through that, 7 p.m.
Yeah, the p.m., yeah. Don't get your a.m.s and p.m.s mixed up.
So, has anybody walked into the clinic so far in the first couple of days that really ought to be bypassed the clinic and gone directly to their physician?
Well, there is a triage system set up. So the nursing staff does, when a patient comes in and stays what they're there for, then they're triaged appropriately so that they get the appropriate care. So
maybe you could give us like a thumbnail sketch of the sorts of things that would require a walk-in clinic.
Cold, fever, cough, suspected fracture or sprain, any kind of minor burns or cuts, nausea, vomiting, those type of things can be seen in the walk-in clinic. Also, we do have a virtual visit system set up. So for those of you that have a computer, you can sign up for a virtual visit, and things like sore throats and colds and things can be treated actually with a nurse practitioner via the computer. And the website to sign up for this is memorialmdsmartvisit.com. And it's also, the information is available at Family Medical Center as well. But
is this a practice that's widely employed in this country?
It is more popular on the East and West Coast.
Well, they always like to be the leaders.
And unfortunately, a lot of my patients don't have computers. So, that's not really something that can be used. But if you sign up for this, it's good for the young family that has a 2 or 3 year old that has a fever and they want to go to work and they don't want to miss work, and they can call in for the virtual visit and give the symptoms, and then the child can be treated. And of course, if symptoms get worse, they need to come in and be seen. But many things can be treated through a virtual visit as well.
So at 8:15 in the morning, if somebody has a problem, they can get on the computer and expect that somebody will respond to them for their immediate inquiry, doctor?
Yes, you have to set the computer up and sign up for the app, and that can take a while. So, but if that's already set up, then it shouldn't take too long. So.
Well, now then, these young people today are all working, and they have to take advantage of daycare. Now, you can't bring your child to daycare, I'm sure, if it has a fever.
No.
So how, in the virtual reality world, do you give them a dispensation and tell them to go and sin no more, take the child to daycare, it's okay?
You would not take a child to daycare as long as they're running a fever. And most of the virtual visits are going to be for older children, not infants. They should probably be seen. If you have a young child that can't communicate or talk, it's almost like being a vet. You need to check them head to toe, so a child that's that ill with a fever that can't talk should be seen in the office.
Yeah,
but for older children that can
medicine,
say, I have a sore throat, then that can be treated with a virtual visit.
But they can spike a fever, just bingo, be perfectly well, and all of a sudden it's 104.
Well, Judith and Doctor, we also live in a virtual reality world here. The virtual reality of it is that we have sponsors, and we're going to have to recognize them for just a minute. So we're going to take a quick break and recognize our sponsors with appreciation, by the way. Go right ahead, Mr. Rash. And having paid homage to our sponsors, whom we appreciate very much, we're right back here live in the studios. The program is Viewpoint, of course. And our guest this morning is Dr. John Wahab. And we're talking about a new part of healthcare in our community, and I think it bodes very well for patients, hopefully for the physicians too. A lot of times physicians see hypochondriacs, like myself, for instance.
Piffle.
So, no, seriously, sometimes people take physicians' time and really not necessary. This is the bridge to that. Maybe a very good bridge called walk-in clinics. And there's a difference between urgent care, which you see in the bigger cities somewhere, and walk-in clinics. We're going to have one. We're going to
have a walk-in clinic.
The cat's going to walk right off the desk. There'll be a new walk-in clinic here. So, Doctor, 2 days on the road now with this, and everything's going smoothly so far. This should be a real asset to Mr. and Mrs. Joe Smith out there on the street. Have something maybe that's bugging them a little bit. Well, I don't think I want to take Doctor. So this is kind of it's a bridge to going in to see the doctors Wahab and Bivens and so forth.
Yes, actually, every visit that the nurse practitioner sees in the walk-in clinic is reviewed by a physician, and the notes are looked at and signed off on. So
I think that's important for the public to know.
Yeah.
The doctors are aware of every patient that goes in there, and that visit is reviewed by doctors.
That's correct.
And we do have the person who sees you is they're very, very, very well trained. They're right to the next step to being a doctor. So your patients are going to be in very, very good hands.
Yes, we're very fortunate. We have excellent nurse practitioners. Very good, actually. And I would not have any qualms about a family member seeing them. So,
yeah.
Well, that's a good recommendation. Another new service that you have is the patient portal. Now, that's innovative. Tell us about that.
If a patient has a computer at home, they can actually sign up for what's called a patient portal. And what that does is allows the patient to look at their entire medical record. And every consult, every lab test, every office visit is accessible to them at their fingertip. Many times I have patients coming in wanting copies of the labs. But if they sign up for the patient portal, then access is given to everything. Everything that is done within the healthcare system is available for them, and that information is available at the clinic. And when you see a physician or walk into the clinic, you just tell the receptionist that you wish to sign up for the patient portal, and they'll give the information for signing up for that.
I bet a lot of people will take advantage of that.
A lot of people have, yes, and it solves a lot of problems where patients leave the office and say, well, what did my doctor say? Well, they can go back and look at the actual note from the office visit and see what was written in the chart. And it's a great asset for people that have used it.
Doctor, I made a remark, facetiously as it was, about hypochondriacs. And in the course of your practice, you see a number of those. That's just the way it is. How does the doctor handle a hypochondriac who thinks thinks they're sick but really aren't?
Well, first of all, you have to determine if there really is an illness. So you really have to look after it. And hypochondriac is a term that used to be used quite a few years ago, and we don't really use that anymore.
Probably not PC, right?
Well, not only that, but there is something going on. If a patient truly thinks they have an illness and there's no illness there, then it could be a component of anxiety. Or some depression or post-traumatic stress or something that's causing that. And so we don't just tell a patient that they're a hypochondriac and then
kiss them off.
No, there's something that probably needs to be addressed, and there may be some underlying issues that need to be looked at. So,
you know what amazes me about you in the medical field is when you do have to go see your doctor every year, and they ask you myriad questions, and they're all very pointed, and they all seem to fit you personally. Of course, I guess you've been seeing the same physician for a while. They probably know you by name, you know? Mm-hmm. But how in the world, your training is so extensive. How do you look at a person and see their soul and know what you have to ask them? How do you know whether I'm depressed or not?
You're transparent.
I am. I know, but some people aren't. If you get somebody who's not like me, say.
Right. And, sometimes it's very easy. Some people are very easy to read. They wear their emotions on their cuff, and it's not difficult. But some people, it takes sometimes a relationship over years. Mm-hmm. I've had patients that I've seen. I've been in Lincoln now. It'll be 19 years next month.
Really?
And I had a patient that not too long ago I've been seeing for probably about 15 years, and finally opened up to me, and we were able to treat her get her in counseling and treat her for a depression. But she would always put up a good face when I see her, and so sometimes it's not so obvious.
Right.
But I mean, in primary care and in family practice. The reason I went into this field was because it is more personable than seeing a specialist and just dealing with one issue. You know,
right.
We're not looking at just the liver or just the kidneys or just the heart. We're looking at the entire patient.
People are more than just a liver, aren't they?
Right. And the relationship is built up over time, and then there's trust that has to be there first. So. That's what I like about primary care. It's not just medicine. You're seeing families, and you watch the kids grow up, and when they're born and grow up and graduate from high school and graduate from college, and then they get married and have children. I've been here long enough to see some of that, and that's the aspect of family practice that I enjoy in a smaller town.
You know, I've heard that from other physicians, that if they went into a specialty, they'd miss this hands-on person-to-person relationship greatly.
Yes.
Yeah.
Proctology comes to mind.
The other is...
most people don't open up to their proctologist.
That's as bad as a dentist or a shoe
There's
salesman.
something to be said for that.
Oofta. Not much personality there, is there?
Well, here we are.
Well, you said that. It's your turn now
to
save yourself.
How is this monitored? This program, walk-in care. Do you have the staff have follow-up meetings and so forth to discuss how it's going and the procedures and the protocol for it, doctor?
Yes. We have a clinic manager that is in charge as well. Also, we listen to patient feedback and feedback from the nursing staff and from the providers, the nurse practitioners that are providing the care. And it's a model that has worked in other communities, and I don't see why it would not work here in Lincoln. And so far, it's off to a good start.
This is such a good idea. What happens to a person who would like to take advantage of this and isn't a patient at Memorial Physician Services?
All patients can be seen. You don't have to be a patient at Memorial Physician Services to be seen. So this is a walk-in clinic that's open to everyone.
Oh, well, that's good news, isn't it?
Yes.
You must disseminate that.
So, Joe or Josephine Smith, have they never seen a doctor at our clinic? and walk into the clinic at any time and
Yes.
be seen.
Or if you have a relative that's visiting from out of town and they have an illness, instead of going to the emergency room, they can come into the walk-in clinic.
That's
That
a
is
great
so
asset. So,
Yeah.
you know, the ages, I'm pretty cognizant of aging right now. The aging factor, do you see so far more of the elderly group in the first couple of days that have walked in, sir?
I'm not aware of the demographics that's walked in, but I think all age groups have walked in.
Probably,
to
but I
the
bet it's
clinics,
mostly old people because this town's mostly old people. I hope you like old people. Lots of us.
The ease of access is important, and this opens up another door for patients in Logan County to come in for these little minor things that perhaps ought to be seen by a nurse practitioner, but they put them off. Now this is available to them.
That's right, and we've been listening to patients and trying to determine how to provide care for them, because when you send out surveys, periodically we send out surveys to patients. In fact, I think it's close to 30 surveys per provider sent out every month to patients that choose them randomly.
The price gaining type thing?
The most common complaint, yes, the most common complaint that we're hearing or concern from patients is access, ease of getting appointments, wait time for getting appointments, and getting into clinic to see and their provider and get health care that they want. And instead of just telling them to go to the emergency room when we're full, we can provide care to them on the same day quickly, and hopefully this helps.
Technology in the age of the computer has made a huge difference in treatment of patients. I recall so well when I was on the board of Abraham Lincoln Memorial Hospital down on 8th Street. Mm-hmm. We always had 2 or 3 physicians that had trouble with their charts. they would have charts stacked up from me to you. We'd have to get on. Today's technology, now the doctor sees Judith K. Busby, and everything he does is entered into the computer right then and there, and the charts are done.
The charts are done. The computer has made. It's kind of a double-edged sword.
Yes, I'm sure
we spend much more time actually documenting things now because we have to document them in the computer, and we have to click certain boxes for certain things, and that is a concern among providers, is that we're spending half of our time documenting rather than seeing patients.
Yes.
Now, we started a pilot program as well. I have a medical scribe that works with me and has been working with me for about 4 months. So he comes into the office, and patients that have seen me in the last 4 months know this, but he comes into the visit and he is typing into the computer while I'm seeing the patient. Mm-hmm. And that's helped me immensely. I like looking at a patient in the eye when I talk to them rather than looking at a computer screen.
Sure.
And it's made my job more enjoyable and more fulfilling. Because I just hated looking at the computer.
It gives you the opportunity to really focus on the patient rather than the note.
Yes.
Mm-hmm.
Yes.
Now, have you had any patient objection to what's this guy doing in here? I don't want to know what I'm
very few. Most of the patients are very happy that there's a scribe in there, and so I'm able to talk to them and look at them when I talk to them. Have them as a major concern.
That's a new opening in the job market.
Yes, it is.
Yeah.
Medical. Do you have to have? Oh, I'm sure you do have to have special.
They have to
training
go through training. Yes. They do.
Spelling lessons, if nothing else.
Yes.
Or how to shorten things up, abbreviate, and so forth, as far as what the computer will do.
It's interesting that you can get around HIPAA, which is the good news and the bad news.
Yeah, so the scribes are trained. Everything's confidential. Nothing goes outside the office.
Sure.
So they go through training for this, as all of our staff does. So nothing is discussed outside the office. Everything stays in the medical record and in the room. Nothing's discussed in the hallway or at the nurse's desk. So.
Right. Well, I think before we leave, we better say again that this new walk-in clinic is at 515 North College Street in Lincoln, America. And the hours are from 8 a.m. to 7 p.m. Monday through Thursday, 8 to 4:30 on Friday, 8:30 to 11:30 on Saturday. You can get yourself over there, get in, and be seen by a nurse practitioner with the aid and abetment of a physician, and things will be swell for you. And once again, the business of the portal, the patient portal, reiterate that if you would, because that's a good thing for people who want that.
Yes. Well, when you come into the clinic, if you wish to sign up for the patient portal, just tell the receptionist that you wish to sign up, and they'll give you information on how to do that. The computer has to be set up. There has to be emails exchanged, and there has to be an access code that is given, which has to be protected, just like your Social Security number. You don't want anybody having access to your medical record except for those people that are authorized. And it's a great asset for getting better educated on your own health and what's in your medical record.
We hope that we've enlightened the folks out there in the ether world about our new walk-in clinic, a new adjunct to healthcare in Logan County. Our guest this morning has been Dr. John Wahab. We appreciate your time, Doctor, and your expertise. We thank you very much for appearing with us this morning.
Thank you for having me.
I always try to close Viewpoint with some sort of a comment that hopefully alludes to the subject matter. If I can read my own writing here, get it up close enough.
So you see it?
We're talking about new things in medicine, and a lot of times there's a lot of new things in a lot of communities that this alludes to. The most dangerous phrase in the language is, well, we've always done it that way.
The Logan County War Cry.
We're now doing it differently. Thank you very much.